Joining us now, the man who's overseeing next week's vaccinations in Toronto, Dr. Kevin Smith. He's the president and CEO of the University Health Network. Nice to see you this morning, Doctor.
Nice to be with you this morning, Rosemary.
So we talked to Major General Fortin a little bit earlier, who says the vaccines are going to start arriving tonight. When have you been told to expect the arrival there in Toronto?
We're hoping sometime tomorrow, midday, I believe, but obviously that shifts by the moment. So we'll be ready. We're ready now, and we'll remain ready until we receive the vaccine.
And how does it work for people in Toronto? How are you? I realize that there's, you've decided who the priority group is, but do people have to call in, or are you calling them? How is it working?
Yeah, the first group that has been targeted are workers in long-term care facilities in Toronto. And as you know, when we look at this mortality of this this disease, it has mostly hit long-term care hardest. So the belief is that starting with long-term care and then moving into broader healthcare workers would be a very appropriate and responsible way to begin. So starting on Monday or Tuesday, we'll be drawing people from long-term care facilities. They'll be coming to a site at the University Health Network. We'll be giving them their first vaccination, and then obviously following up with them, and 21 days later, they'll be back for their second vaccination.
Well, that's a good, the timeline there is important, because I don't know if everyone understands how that's going to be tracked. What have you come up with in terms of identifying the person who's getting the first dose and then making sure they get back to do the second one?
So working with General Hillier's task force, as well as the province and a number of agencies associated with this, like the Ministry of Health, Ministry of Long-Term Care, etc., we've basically identified the homes in the GTA, particularly homes that are and have experienced some struggles with COVID, and that is many. With those homes, they'll be identifying staff, and likely laterally, because of the demand for this vaccine, we'll be looking at a lottery system so that people who wish to go first or go early can apply, and we can randomly draw them so that it's fair.
Okay. Are you picking homes, though, that currently have COVID infections or have had COVID infections in the past?
We're really looking at all of the homes in the GTA or in Toronto per se, mostly related to their geography so that it's easy for people to get to us. Unfortunately, there's about 110 to 15 homes in outbreak across the province. So I'm sure that a number of those will have or have had outbreaks recently.
So these are obviously for the workers. What about the people inside the homes? How do you, because you can't obviously transport it, you can't get them to where you are. You'd have to bring it to where they are. So how is that going to work? Do you know at this stage?
Yeah, so this vaccine at this moment, because it's still new in its distribution, there is concern about the volatility of movement, so that it's been recommended that we not transport the vaccine until we have more experience with it. And we're working closely with Pfizer, as is everyone literally around the world on this point. The likely outcome now is that we wait for the Moderna vaccine to be received. Okay. And the Moderna vaccine apparently has less risk in terms of transportation. There's less volatility of the molecule, the science of this interesting vaccine. So we'd likely use the Pfizer vaccine for long-term care workers, and the Moderna vaccine would first go to long-term care residents. Okay.
So we're getting 30,000 doses in this first delivery over the next 24 hours or so, Doctor. How many are going specifically to Toronto and maybe for Ottawa as well?
My understanding is that 1,500 doses are going to each. So, and of course, if you use half of that, 3,000 doses rather are going to each, and you'd use half of that, 1,500 people, so that we're sure we have the supply for 21 days later. None of us are making any assumptions about the supply chain, so we're being very cautious to ensure that not a drop of this is wasted.
Yeah, for sure. Have you had people call and say, how can I do this? How can I get in line? I'm desperate for it.
Yeah, absolutely. Calls, emails, you name it. And again, I know that'll be one of the challenging parts of this administration. We are, as you know, making sure that we prioritize those most at risk, those working with long-term care residents. And we also know from the science that it's often the long-term care workers who, because of community spread, end up bringing it into long-term care. So it really is a risk-based assessment of who goes first. There are a number of groups, ethicists, clinicians, you name it, really working on then what is the appropriate order of people following long-term care workers and residents. And I know before the next round of vaccine lands that we'll have some plans for that, which I hope General Hillier's task force will then approve. And we can be clear with the public exactly what order we plan on distributing the vaccine.
And tell me, just from your perspective, how complicated is this? Like, have you done anything like this in your lifetime? Are parts of this things that you're comfortable with, and other things it's just sort of mind blowing in terms of the complexity?
Yeah, you know what? We have done some things modestly like it, particularly in the early component of setting up a process that ensures that we're really using good process measurement, leaning it out, really being effective and efficient, and have backup plans for literally everything and backup plans on the backup plans. What is daunting, what we aren't familiar with, I think, is the scale to which this will grow and quickly. So at some point when the vaccine is flowing freely around the globe, it's anticipated that we'd be doing 1 million Canadians a month. And we've never done anything like that in our history. So we're now working diligently with all players in the healthcare system and well beyond to say, how will we logistically make this work? The other piece of this is healthcare workers are super busy right now. They've been working really hard for a long time. And so that's a big issue. Do we have the right people? Can we train up additional people? All of which we're doing now, working towards now.
Well, I noticed in the United States that they are they're putting these in pharmacies. You're going to be able to go to a pharmacy and get an appointment and get a vaccine. Is that something that Ontario should be doing, given the numbers you're talking about?
I think that will, down the road, as we see the flow of the vaccine, it is something we'll have to consider, and I'm sure the task force is considering. I think at the moment, the integrity of protecting the supply and ensuring that it's administered appropriately, and then the data system to capture what vaccine did you get, when did you get it. If you happen to have forgotten, obviously, if you got a Pfizer vaccine, you don't want to come back and get a Moderna booster. So many of those issues really need to be cleaned up, and standard operating procedures airtight. One of the great things about having a general lead this process is they're really good at that kind of work.
Yep.
So I think that'll be a decision down the road, but it wouldn't surprise me at all, Rosemary, primarily because of the size and scope and responsibility of this initiative.
Just final question, Doctor. So there's a first batch of 30,000 coming in. What have you been told about the next batch and how much you can expect on the next wave and when it's coming? Have you been told anything?
Only be ready anytime, all the time. So, right. So, which is great. We're optimistic. The earlier, the better. So many people want to get this. A little bit of anxiety about the holiday season where people, as I said, have been working so hard. And they do need a bit of downtime, but everyone is united. If that vaccine comes in, we want to get it into arms as quickly as possible, and all of us are prepared to delay any holiday time that's booked in order to make sure that that happens and bring life back to more normal.
And Doctor, will you get the vaccine?
I certainly will. When I fall into the category of people who qualify for the vaccine and when it's appropriate for me to get it relative to the broad population, I will be first in line. The science behind this vaccine is amazing, Rosemary. When we think about just a year ago, this brand new disease, the world scientific community has come together and then the commercial enterprise has come together. We've never seen anything like this. And who would have thought that an investment in 1960 that saw the discovery of messenger RNA today is what's going to literally save the world and turn around our economy.
Yep, you're not even overstating any of that there, Doctor. Thank you so much for giving us the perspective of how it's going to unfold in Ontario. Appreciate it so much.
Thank you so much.